Hello, and I know you guys can read, so you'll know that I'll be doing a report on pediatric heart failure. Also, my name is Shay, and well, I go to school here. So, I want to start with talking about just that broad definition of heart failure and then some of the common causes. From here, we'll lead into a bit more about the statistics between the adults and children, and then kind of go into the presentation of the disease in respect to those similarities and differences, and how we can treat them pre-hospitally if it really is any different from the adults, which it really isn't, except that, kids tend to be more scary. Then I'll finish on how the outlook is for children compared to those older counterparts. That is the prognoses. So I'll try to skim over the boring stuff, the details that we already know, that is the adults, and the broad definition. The broad definition really doesn't change too much between the adults and children. Essentially, it's that the heart is the responsible party for not transporting enough blood or nutrients across the body that the body demands. So there's really no change here. If you don't believe me, you can click on those two links underneath to see exactly what I just said in more detailed words. But the biggest difference that I noted, and really domino effects into how we treat and all the different statistics, is what causes congestive heart failure. So for adults, we have those chronic illnesses and those comorbidities of generally either genetics or not so healthy lifestyle. But for children, we tend to see this in children who are less than 1 year old, and it's actually due to congenital heart diseases, or different various cardiomyopathies. So really, it's that structure that's causing this congestive heart failure. So for instance, we can see how that affects the statistics. We see the incidence, which is the new cases, are much less than adults, but these are due to changes in congenital heart diseases and cardiomyopathy from near birth. So really, we have a whole range of adults to just the first year of birth. So of course, there's going to be a lot more people that are adults than there are children. So moving on from here, we can also see that 65% are actually due to that congenital heart disease and the cardiomyopathy. So that being said, they do present differently. We know the common adult signs and symptoms here. For those with less than 1 year old, it's really hard to describe because it's hard to get that patient history, especially from a baby who can't talk. So normally they will have that vague failure to thrive. They won't feed very well or have just not feed at all. So no weight gain, which is a very concerning thing. They have tachypnea, which can be over 50 breaths per minute, excessive sweating, and tachycardia that can reach over 220 beats per minute, where normally we see that 120 to 150 range. So sounds pretty familiar, right? Pretty much any other sick kid that we would see in a less than 1 year old. I'd also like to note that for older children with congestive heart failure, we'd see similar signs as like adults would be, but that's a lot more rare, as children that are more closer to adolescence don't have congestive heart disease, congestive heart failure as much. Sorry, jumbled my words there. That being said, the treatment in pre-hospital or in general really depends on those four factors. We want to reduce preload and afterload. We want to enhance that cardiac contractility, and we really want to ensure the oxygen and ventilation delivery, and really just talking about the enhancing nutrition and those social habits. So on our end of things, we can really work on securing that ventilation and oxygenation. So for treatment pre-hospitally, CPAP doesn't really come in those neonatal sizes, at least not for us. So we really want to make sure we use those ventilations. Another thing, just as with adults, we don't want to fluid overload these children. And the rest really needs to be done in hospital, because it's really the correction of those defects through surgery, as we've talked in the previous lectures about how those structures could be altered. So the outlook or the prognosis for congestive heart failure is really linked for adults in that chronic idea. So the comorbidities due to those cardiac causes. So, it's chronic, it's going to be lasting for a long time. However, in children, it really varies because of that underlying condition. That being said, we really don't see this in the field as much, as they're usually caught during exams after birth up to 12 months and all those different imaging in hospital. Therefore, our focus really should be on um, highlighting the supporting of the children's system and really getting them to the hospital so they can actually receive the treatment that they need, again, which is usually the surgery or helping with medications to help them outgrow this congenital defect. So that's the majority of the presentation here. Hope it was helpful. All in all, just keep your patient alive and go fast, just like every other patient you would that's a pediatric baby.